I want to welcome everybody to the 24th in a series of free webinars for peer supporters. Rita, we've done 24 of these. It's amazing. We're going to talk to you about a survey that Alan and I were involved in, Alan Daniels and I were involved in, related to compensation for peer support specialists. So I want to thank you for your participation. So this is being recorded. So this is a disclaimer for anybody that's on the webinar. This is being recorded. I'm the moderator. My name is Peter Ashenden. I'm the Director of Consumer Affairs for Optum Health Behavioral Solutions. I've been in this position now almost 6 years, and I've really been able to take and change the landscape of things. Let's go to the next slide, and then when we get to the introductory slide, all right, so this is a report from the National Survey on Compensation Among Peer Support Specialists, and the presenters are Alan Daniels and myself. I am a person that has the lived experience of being in recovery now for almost 30 years. I was diagnosed with mental health issues in the early 1980s, and I didn't find my path to recovery until I got into a peer support group, and that's when I was able to find my path to recovery. I do know that when I was in clinical treatment, the position that people were taking with me was that I'd never be able to work, and I'd never be able to hold down a job. And I got to tell you, when you tell me that I can't do something, that's usually when I dig my heels in and I say, all right, I'm going to take and show you. So, I have, as a person who was told they would not be able to work, I've run an agency in New York State for 12 years called the Mental Health Empowerment Project. From there, I had the opportunity of being the CEO of PDSA, a position that I thoroughly enjoyed, where we were able to speak and reach out to 5 million people. And then, of course, I came over to Optum almost 6 years ago. And at Optum, I've been able to build programs that help to keep people out of the hospital, help the people find their path to recovery, and be able to move on. So for a guy who was told he'd never be employable, I think that demonstrated that I was employable. I wish at the time that I first started my employment that this survey was available, because let me tell you, when I first started working in the field, the money was ridiculous. And the money still is ridiculous. But, the pay was really, really bad. And we're going to give you some skills, and we're going to give you some ways that you can take and advocate for yourself. So, on that note, Alan, do you want to say a few things? Or should I do the learning outcomes now?
Do the learning outcomes, then I'll jump into this.
Okay. Understand the difference among peer support specialist compensation. That's going to be one of the outcomes that you will have. Identify differences in the compensation rate paid to peer specialists based on the type of organization they work in. Recognize that regional differences in compensation for peer specialists based on states where they work. So we've been able to take and regionalize what the pay is in various regions throughout the United States. Identify differences and inequities in compensation between male and female peer specialists, which we were both very surprised at the difference there. And understand how peer specialist compensation rates can be developed and use national and regional data to advocate for individual employment benefits. So those are going to be our learning objectives. As I said to you, Alan has done the yeoman's work of putting this survey and this work together. I think he's done a fantastic job with it. I'm very, very impressed with it. And before we get started, I'm going to share with you real quickly. I'll tell you what, I'll wait till the end. We'll go through that at the end of it. So at this point, Alan, may I turn it over to you?
Sure. Let me introduce myself, and then I'll turn it back to you for the initial part, Peter.
Okay.
Greetings. My name is Alan Daniels, and I am based in Cincinnati, Ohio. I am clinically trained as a social worker. I have been involved in my career in running clinical practices, running managed care organizations, and also in leading consumer and peer organizations. I've worked extensively in health policy and am committed to the role and field of peer support as a valuable and absolutely important component of the health services we provide, both for physical and behavioral health. So, as Peter said, we've been able to pull this survey together, And the plan for the presentation today is that Peter will do some of the early organizational and background on the study, and then I'll walk you through some of the data. I will mention one thing, which is that some of you all may have heard parts of this presentation at the iNAPS National Convention. However, the data we were presenting at that time was completely preliminary, so these are now the final published results, and we'll tell you how to access the survey as well. But why don't I turn it back to you, Peter, and let you begin.
Thank you very much, Alan. Thank you very much. That was a nice introduction. So you all know that I work for Optum. I discussed that with you before. So let's take a talk about some of the background that we had before while we were starting this report. So the peer support specialist workforce has been a growing and expanding area since Medicaid established funding for these services in 2007. So, we've seen a fair amount of time where Medicaid has said peer specialist work can be taken and paid for with Medicaid dollars. Researchers continue to expand and support the evidence base for these service systems. Peer support specialists are also increasingly recognized for their essential role in promoting person-centered services that promote engagement and activation that fosters recovery and resiliency. It's absent from much of the research on peer support specialist workforce it has been absent from much of the research on the peer support specialist workforce has been a review of wages and compensation. So while there has been other research work that's going on, Fabian, could you please turn off your video again? It stops me from seeing who the participants are in the room. Could you please turn your video off, Fabian? A central goal of the compensation survey is to inform the field and provide resources for advocacy on peer specialist wages and employment. And again, this is an important area. We should be looking at, are we compensated for the work that we're doing? Are we being properly compensated? And this presentation updates preliminary survey results presented at the last iNAPS annual meeting, which Alan just mentioned a few moments ago. We gave you the preliminary results of the iNAPS meeting. These are the final results that you're seeing today, and we feel comfortable with that. In 2007, as I mentioned before, the Center for Medicare Medicaid Services described peer support services as evidence-based and designated these services as reimbursable under the state Medicaid plan. Medicaid Medicare Services defines a qualified peer supporter or a peer specialist as a self-identified consumer who is in recovery from mental health or substance use condition and assists others in their recovery. Then we had a report out of Texas, and this is in 2014, by Kaufman and his associates. 37 states have developed training and certification standards for peer specialists, and there is a wide variation across the states. So there's different ways that it's been implemented, but we are looking at 37 states have taken and developed training and certification standards for peer specialists, and some of them look the same and some of them look very, very different. And based on the Nashville 2015 state survey, peer support services are currently reimbursable in, again, at least 37 states, and this was as of last year's information. Again, Fabian, I'm going to ask you to please turn off your video. Next slide. The Bureau of Labor Statistics Standards of Occupational Classification System includes over 800 detailed occupational categories used for collecting, calculating, and disseminating data and information on job characteristics, workforce distribution, and annual mean wages. There is no specific job classification for the peer support specialist occupation. There is not a job classification in the Bureau of Labor Statistics, and the closest similar category is for a community mental health worker, which serves as a useful benchmark for this workforce. The mean wage for this particular role is $18.35, and we'll get into the other salaries with you that we've been able to take and determine as a result of 1,600 people that participated in the survey. The Bureau of Labor Statistics describes the community behavioral health worker as a unsafe behaviors, conduct outreach for medical personnel, for health organizations to implement programs in the community that promote, maintain, and improve individual and community health. May provide information on available resources, provide social support and informal counseling, advocate for individuals and community health needs, as well as and provide services such as first aid and blood pressure screening, may collect data to help identify community health needs. Now, the one thing that's missing in that description that really sets us apart, having the lived experience takes and gives us a much better opportunity to engage with a member, to engage the person who's really struggling with their mental health issues. In the VA system, and I really praise the VA system for doing this because they had the insight to see the importance of developing a career ladder. Peer specialists are employees who help veterans with serious mental illnesses and substance use disorders to successfully engage in treatment and recovery. The peer specialist position is classified as grades 6, 7, 8, or level 9. And again, this gives you a career ladder. So if you come in as a grade 6, there's things that you need to do to get to be a 7, need to do to be an 8, and need to do to get up to a grade 9. And from what I understand, a grade 9 is a fairly livable wage based upon my experience with the federal government. So let me take and give you a couple of resources that are important for you to take a look at. We will have this slide deck on the website. Readable, take and go over that material with you at the very end of the presentation. But you will be able to go ahead, read it now. Okay. I thought I heard Rita say something. I'm sorry. Let me go over these notable resources with you. The Pillars of Peer Support Initiative, supported by Optum and others, is available at the pillarsofpeersupport.org website. We have, the years 2010, 11, 12, 13, and 15. So we've really been able to take and demonstrate that we did a very careful look at the pillars, at the power of peer support and how effective it is through these meetings that we had each year. Peer Services Toolkit, a guide to advancing and implementing peer-run behavioral health services with Henry Hill and Rosenthal. That can be found at the ACMA website, and that's right here on the right in the PowerPoint itself. Center, if you want to see the letter, the original letter in 2007 from Center of Medicaid Medicare Services, you can access that at that website. And then Matt Shinman has done a lot of work on peer support services, especially in the VA, and he's been doing very, very interesting work there. And Kaufman, as I mentioned before, peer specialist training and special programs, and he did a national overview of that. And then, of course, we also have right here on our own agency, iNAPS, the National Competencies for Peer Specialists. And you can find that at that particular location. So, next slide, please. I believe at this point, if I'm not mistaken, Alan, do I turn it over to you?
Yep, I will take over from here. Thank you. Excellent job, Peter.
Thank you.
Welcome all. A few comments about the slide template as we begin. You'll notice there's a graphic of the words on the top left and right. This is a word cloud that was created from the written comments we received as part of this survey. And the size of the word gives you an illustration of the frequency with which it was raised by the respondents to our survey. And also at the bottom of the slide, you'll see the website where you can access the full report. And again, you will have access to the full slide deck by participating and filling out the survey today. So you'll be able to reach that site and read the report in full, but I'll be giving some summary background on today. So a little bit of the survey. We conducted 2 surveys to try and address the question of what it is that peer support specialists make. And we did this by one survey for peer specialists and another that we disseminated to organizations that employ them. The individual survey had 13 questions. The organizations had 14 questions. Excuse me, we used both open-ended and fixed responses. We did this on SurveyMonkey, and the survey was live for a 1-month period of time in June of 2015. Maybe more geeky than you want to know, but non-probability sampling methods were used. There was no limitations on the respondent, and basically it was an open call for responses. In the past, most of the surveys that we've seen in the peer support specialist world have generated probably between 300 and 500 responses. So we were anticipating that our survey of peer specialists would have about the same response rate. We had triple that. As Peter said, we had 1,608 individuals respond. And for organizations, we had 271 organizations responded, telling us about the peers that worked in their organization. The next slide you'll see here was response rate by state. We only had one state that had no responses. We had respondents from every other state in a breakdown, as you can see, between categories of 0 to 5 and over 100. The survey was disseminated. A great job by iNAPS, by BBSA, and N.A.P.S, all three, helping to put the survey call out there and help us recruit people to participate in the survey.
Alan, we should also mention that the NHA of Southeastern Pennsylvania, Joe Rogers and Susan Rogers, were very instrumental in helping us get the word out to them.
Yeah. And many people, and actually probably the biggest, was word of mouth. We heard from peer to peer, multiple peers saying, I was suggested by my fellow peer to fill this out. So we had an overwhelmingly favorable response rate and really appreciated all those who helped us promote the dissemination. Again, a little bit of the background and demographics of our responses. On the individuals, 87% were certified. And again, not all states where we had respondents have certification for peer specialists. So that accounts for the amount of respondents in the certification category. The response rate by gender was kind of 2 to 1 in favor of females, which anecdotally is what many people have said the peer specialist workforce is likely to be. So we think that mirrors the workforce overall. We also asked people in the responses to self-identify or type of organization where they were employed. And we set up the following categories for them to respond, which included consumer and peer-run organizations, community behavioral health organizations, healthcare provider organizations, inpatient psychiatric facilities, health plans or managed care, and several folks also responded with multiple organizations and some with no responses. You will see throughout this survey a lot of categories of no response. And so what that means is, we had answers to some questions, but not in all categories. So the number of no responses varies by the question. And again, it's the information that people gave us. And the total responses, again, was 1,608. We looked at in the survey responses the number of hours that people worked. We broke them down into less than 10, 11 to 20, 21 to 30, and 31 to 40 plus. And basically what you see in the percentages here of what the responses were, we had sort of the largest, 3/4 of the respondents were in full-time employment, and the rest were probably clustering around half-time. We also questioned the tenure or how long people had been working in these roles. We had the largest group in the 1 to 3 years and equal percentages below and above that. And again, these are all self-reported by the peers who responded. So now we're beginning to get into some of the meat of what I suspect most people want to know, which is how much do peer specialists make. And we broke it down by categories worked. In the less than 10 hours a week, it was $13.62. In the 11 to 20 hours, it was $12.49. $12.67 in the 21 to 30. And the full-time range was $16.36. There are two numbers I'd like to call your attention to on this slide. We have the full-time number, which is the $16.36, and we have the all-hours work number, which is $15.42. So you will see those two numbers reflected as I go through and talk about the numbers that we found in this survey. So, next one, which was very shocking to us and surprised us, was the differences in pay by gender. We thought that it would be close to equal, which was perhaps naive on our part because we know that in the American culture, that women make about 79 cents compared to men on an average dollar of earned wages. And these numbers are fairly close to that split. So, unfortunately, the gender gap prevails through this as well, which is unfortunate and something we need to figure out how to address. We also tried to look at the types of wages and the tenure in jobs by organization. And I'm only going to focus here on the total number. Again, you'll have access to these slides later to go back and drill down into some of the data that you'd like to. What you can see here is for all hours and all tenure work, consumer organizations pay peers a little less than community behavioral health organizations, and the highest rates is in managed care plans. And I might, go back to something Peter said early in his presentation. Community health workers, which are probably the closest comparison, both on the Federal Bureau of Labor Statistics and on the medical side, the average rate for that workforce is $18.35, suggesting that this workforce is paid a little bit less than what perhaps might be a reasonable benchmark. So, organizations that employ peer support specialists, this was the second part of our study that we talked about. And here we asked the organizations that responded to respond by the size of their staff. And so again, you'll see on the left side of this chart the standard organizations we used for the types of organizations. And we have, again, consumer-run organizations, community behavioral health organizations, healthcare provider organizations, psychiatric inpatient facilities, health plan managed care organizations. And I saw a quick question fly by my screen, so I'll try and address it now. I won't be able to answer them all as we go at the end, but someone said they were confused by the no responses. So again, the no responses are that we may have had data for certain information, but not necessarily by the specific slide that we're looking at. So in this case, let me give you a previous example here. There were certain data on the average job, tenure and job and wages that gave us no response either to the tenure or the job organization they were in. So we have no response filtered throughout the entire survey. We asked the organizations that employ peer specialists to give a starting and maximum salary by type of organization. And again, this is reported by the organization that employ peer specialists. So what you can see on this slide is starting salary ranges by types of organization and what these organizations reported on average as their maximum salary. So starting salary for consumer peer organizations was $12.23 as compared to health plan managed care organizations at $17.25. Consumer organizations maxed out around $15.50, and health plans more in the mid-$18 range. We also tried to understand if there were established job descriptions for peer specialists by organizations. And the overwhelming response was yes, there were job descriptions by organizations. We also had this question for the individual peer specialists who responded, and overwhelmingly they also reported that they do have job descriptions. So we think that this is a very important key factor in this, to say that the workforce does have job descriptions, but guide their work and direct the work they do. We asked the organizations that employ peer specialists if they have face-to-face service requirements by organization, And that would be things like you have to see X number of peers per week or so many hours. And the responses to this came in really broken into three categories, almost equally, of yes, no, and no response. And in looking at some of the feedback, we think that the no response was provided by some organizations that really didn't understand the question of what we were asking. So, again, we were trying to find out if peer specialists have productivity expectations for what they're supposed to be doing. We asked and wanted to understand in organizations that employ peer specialist supervision. That has been one of the reports in the Pillars of Peer Support that Peter referenced earlier. And so we asked who supervises peer specialists, clinical staff, other peers, or others. And what you'll see in this slide is a fair number of other categories again. When we tried to unpack and better understand that number, what we think that accounts for is a large number of peers who are supervised by both some combination of peers and we get somebody going unmuted.
Pick your line. Thank you.
Okay. So another issue we tried to look at, again, to be able to provide some resources for advocacy for peer specialists, was the frequency of increases in wages provided to peer specialists. So we asked that question of the organizations that employ peer specialists, and what we found was that 44% of organizations report that they annually increase peer salaries, and 35% do it occasionally. So we also asked that question of individual peer specialists, and again, about the same number, 45%, reported that they received annual wage increases. But we found a striking number in this result, which was that 30% don't know how often they're eligible for increases. We don't know exactly what that number means, but we think that there may be some opportunity for peer specialists who may not be as versed in employment literacy skills to know how to ask or understand when they're eligible for increases. And again, maybe an opportunity for follow-up work by some of the organizations involved in promoting the role in the workforce of peer specialists. So, the next thing we tried to do, because we wanted to provide peer specialists the ability to have reasonable information on salaries by their state, their region. And since we had some states that had very few respondents, we went to the Health and Human Service Regional Map, which is also used by SAMHSA, and breaks down 10 different regions around the country. And so we aggregated the data into these 10 regions. I'm going to walk you through that in a minute, to identify what regional salaries or wages were for peer specialists across the country. And this slide just gives you a breakdown of the region and the response rate by those regions. And again, to the person who asked the no response question, 7 respondents of the 1,600 did not tell us what state they lived in, so we couldn't then attribute them to a particular region. So, in this next slide, what we have is we've broken down the average salary or wage by region and provided some summary of the gender breakdown by region for female and male peer specialists. And I'm going to walk through relatively quickly in a minute some information on each of the regions that will allow you to drill down deeper into your wages, your compensation in your particular region. One of the things that Peter mentioned was that we hope this report can be a useful technical assistance tool to peer specialists. And we've already heard one story where in a particular state, 6 peer specialists took the report into their annual employment reviews to have a discussion of wages with their supervisor. So in many cases, we anticipate that peer specialists may have better employment and wage information than their employers may have, and we hope this provides useful information to foster these professions. So we have a breakdown for each of the 10 regions, and as you'll see on this region, it's region number 1, which is the northeast part of the country. We have 2 tables that we provide information in each of these regions. Peter talked about the state certification and the Medicaid billable status, state certification by the Kaufman Report, Medicaid billable status by NASHRID, National Association of State Mental Health Program Directors survey. So we tried to give a kind of a snapshot for each of the regions by certification and billable Medicaid status. And then what we did was we took the average salaries, wages per type of organization for that particular region, and we compared those with the national average, which is the table just to the right of the map. And then in red, what we did was highlight those particular areas or employer categories where peers reported having lower than average compensation rates for the national average. So for this example, in Region 1, healthcare providers, managed care and health plans, and multiple organizations employing peers pay less than the national average does. In Region 2, you can see that the wages fare much better, includes the states of New Jersey, New York, Puerto Rico, and the Virgin Islands, where we had no respondents, so we didn't include them in the survey. And again, gives you the breakdown by type of organization and the national average that you can compare to. In Region 3, which includes Delaware, D.C., Maryland, Pennsylvania, Virginia, and West Virginia, again, we have the certification and the billable status. And we can see in this region that the compensation rates are significantly below the national average in many of the categories. And again, let me reiterate why we did this regional approach, because each time we've presented this survey, we've had a question that has been something like, can you tell me in my community what the average compensation rate is for peer specialists? And the average is no, we can't. We don't have that granular information, but we do think we have reasonable data to support what the particular regions are likely to make. So moving around the map as we move to Region 4, again, there's several areas that are below the national average, looking at the states of Alabama, Florida, Georgia, Kentucky, Mississippi, North Carolina, South Carolina, and Tennessee. Moving up to the middle of the country in the north, peers fare a little bit better there, with really the main category of community behavioral health being slightly less than the national average. When we move down to the south, again, we see some deficiencies below the national average in some of those organizations. When you move to the middle of the country, you see that just about everybody is below the national average: Iowa, Kansas, Missouri, and Nebraska. And what we didn't do is compare how the average wages by region compare to national averages overall. I suspect that some of the Midwest and other areas are probably lower in national averages anyway than the coasts. We weren't trying to get that granular. We tried to give you resources to be able to advocate for your own wages and have that discussion with your employers. By Region 8, again, several of them are lower: Colorado, Montana, North Dakota, South Dakota, Utah, and Wyoming. I believe that South Dakota was the one state that we didn't have any respondents from. Average salary for Region 9, again, there are a few areas where it's deficient, below the national average. There are also a group of associated territories that we didn't have information on, but they're included in the region. Region 10, which is the Northwest, only the healthcare provider organizations and the blank compared less favorably to the national average, looking at Alaska, Idaho, Oregon, and Washington. So that gives you an overview of the peer specialist compensation. And in this next part, what we want to do is provide you a framework that looks at how peer specialist wages might be set as we increasingly move to fee-for-service reimbursement, which is what many Medicaid reimbursed states are now doing. So what we did was we developed a standard set of assumptions. I'm going to walk you through these fairly quickly, and it may be a little complicated presentation, but as you drill down later, you can follow this. You can change the assumptions around, but they would support a reasonable discussion with the employer to understand what kind of reimbursement peer specialists might make. So, a peer specialist, we thought, could average, and these are all based on real-life examples combined from several different states. A peer specialist can average 60% direct billable service over the course of a week or a month or a year. A full-time work year is considered at 2,080 hours, so that means that a peer specialist could generate 1,248 hours per year of direct service. However, most full-time work is less 20 days vacation, sick, and holidays, which comes out to 160 hours a year, for a total of 1920 total work hours per year, or about 48 weeks. So we took that 1,248 hours of direct service and then divided it by the 48 weeks, which comes up with a direct service assumption of 26 billable hours a week. Again, these are all assumptions. The model can be tweaked to adjust to whatever environment you're working in. But we then said, if we look at what standard reimbursement seem to be evolving for states, fee-for-service reimbursement rates roughly equal $15 per 15-minute or minute unit of service, or about $60 per hour reimbursement. As a note, we based this entire example on individual services. It can be modified and a formula challenged or changed as you bring in group reimbursements and things like that. We took the $60, because again, we're trying to keep this as simple and straightforward as we can, times the 1,248 hours per year, which said that there's a potential for a peer specialist to generate $74,880. But before you get all excited and think, gee, I'm way underpaid, consider that it's unlikely that any organization is going to generate 100% reimbursement on the services provided. So a liberal reimbursement rate would be 85%, or a liberal collection rate. So we took the total annual reimbursement and calculated that at 85% and came up with a total annual reimbursement potential for a peer specialist of $63,648. So this next slide has a lot of information on it. Basically what it says is that there are direct and indirect expenses for the organizations that employ peer specialists that break down what some of the direct costs are, what some of the indirect costs are in the organization, and that most organizations will come out in the range of 20% of revenue organizational operating expense. And again, as I said, these are based on actual examples across states. So we assume that 20% organizations are going to need 20% of what's brought in revenue to cover their expenses. So we say that the total annual reimbursement potential for a peer specialist is $63,648, less the 20% organizational overhead brings it down to $50,918. $50,918 divided by 2080 hours equals $24.48 per hour. When we took out the 70% employee benefits, it brought it down to $17.13. So using this model, what we calculated, I know this is complicated, I ran through it relatively quickly, we think that on this model, the maximum peer specialist salary would be about $17.13, for an average wage of $35,630. $17.13 is a little higher than the $16 range that we found for the average salary, and it's below the $18.35 range that we saw for community health workers. So, in your information, you will have the email addresses for myself and for Peter if you choose to follow up with our questions that we don't answer today. And before I stop and move us to questions, I'd like to acknowledge the College for Behavioral Health Leadership For those of you who are not aware of this organization, they have a strong commitment to peers for the leadership in the behavioral health community. They're the ones who graciously published our survey for us. Their website is there if you'd like to learn more about them. And so now, please use the chat feature, and Peter and Rita will be moderating the questions, and we'll do our best to answer questions.
Rita, do you have any? I'm just opening up the chat function now. Do you have any questions that you have on hand, Rita? Okay.
Just Rita on mute, maybe?
I don't know. All right. So anybody who would like to take and ask a question at this point, if you would be so kind as to select in the send to chat function, if you would select everyone and enter in your question, I'll ask it of Alan, or I'll try to answer it myself if it's geared towards me. Can I bill for individual hours to Medicare directly? That's from Frank Jones.
I think the answer to that...
There is reimbursing peer support services yet, Alan. Do you know more about that than I do?
I don't believe Medicare is. Medicaid is. It might have intended in to part of Medicaid. But I do not believe that peer support services are reimbursable by Medicare at this time. They might be reimbursable by a payer that administers the Medicare, in which case you could find out who the intermediary or the managed care partner for Medicare is in your particular state, and they might be able to answer that question for you.
Okay. The next question we had was, what was the average rate of pay for an uncertified care specialist?
I believe we have that in the data. We don't have it in the presentation, so if the person wanted to email me, I could probably look it up. But a caution about that is that it's probably not a good number, because you could look at a state like California where there is not any certification currently for peer specialists. And that might be very different than somebody from a state like Georgia where there is certification but the person isn't certified. So my guess is our number may be hard to get to what that person's really asking. But again, if they want to email me their questions separately, I'd be glad to try and see if I can get them any information.
Well, why don't we skip back to the last slide so that Felicia can write down your email address.
Yeah, and please on my email address, everyone, if you're trying to reach me, note that there is an S between Alan and Daniel. There are some Alan Daniels out there that get a lot of my email and never tell me about it. So if you send it to just Alan Daniels, it won't make it. But if you put the S in, I'll get it and I will respond.
The next question I have is, why would a healthcare provider organization which has an inpatient unit make more?
Well, I think that what we saw was it varied by types of organization. And it could be that there is more revenue available within an inpatient facility than there is within a healthcare facility, which is probably more like a community behavioral health organization. But again, what we were trying to determine was how much of a difference is there among different types of organizations. And might we be able to challenge some of the lower paying organizations to figure out if there are ways to increase the compensation. And again, as I said in my comments, we were very pleased to learn that there was, at least in one state, several people who took this report into their supervisors with them for their annual review to include compensation as part of their annual review discussion.
All right. Frank had asked a question earlier about billing Medicare directly, and now he's placed another. I've got to find out where it went. That question ran so fast. Then he said, as in a private need a little bit more clarification on what you're asking. I'm not. What do you mean by in a private practice? Do you think that in private practice you're going to bill Medicare? I need some more specifics.
Well, let me take a crack at it here.
Right, go ahead.
Because there are pure specialists who do work in private practice, either by themselves or in some cases with clinical providers. In my understanding, they have a challenging time billing and getting reimbursed for those by payers because they're not often covered services. But there are some private practices where there is self-pay and where people will, in fact, pay for those services on their own. I suspect there are some peer specialists that may have clinicians who are billing under their license for those services, but I would offer caution about that because managed care companies frown upon that kind of billing procedures. And again,
were you finished?
Yeah, one more thing on that. And again, if Frank has specific questions he wants to email me, I'd be glad to try and answer them as best I can.
Okay, the next question we have are these rates and the survey for certified peers or peers providing services, and was there a big difference in the outcome?
Say that again. I'm not sure I got the question.
Yeah, it's a little confusing, Antonio. Are these rates and the survey for certified peers or peers providing services, and was there a big difference in the outcome?
Well, a couple thoughts, and again, I'll try and answer it as best I can understand it. In terms of outcomes, we didn't measure anything related to the quality of care, only the compensation of care. Again, someone had asked earlier about certification, and we were beholden by what people told us about certification. But again, that's a bit of a complicated question. We weren't really looking specifically at certified versus not certified, or we couldn't because different states have different certification requirements. So it did appear that people who were certified, by and large, made more money, if I recall correctly. But again, it's hard to draw a conclusion if you've got some states that may have a large and involved peer workforce, using California as an example, that don't have certification. And when you try and compare that with someone who's not certified in Georgia, working doing peer support, where there is certification, it would be two very different situations. So it would be kind of an apples and oranges comparison.
This is an interesting question. What differences are there in effectiveness of service between paid peer specialists and volunteer peer specialists?
It's an excellent question, but it's totally outside the scope of our study.
Yeah, I thought so. Okay. Why would a healthcare provider organization which has an inpatient unit you asked me that question before, Felicia. All right. Will this information be used to move to have national peer professional workforce and associations? I don't know how you predict that.
Well, maybe that's a good segue, Peter, for you to talk about how this survey came about and what our hope for this survey is.
Okay. One of the things that I wanted to take and mention to all of you on the phone, most times when you have a survey like this, it's funded by some entity, either a government entity or a state entity or some entity, maybe a private foundation or some kind of some entity. And what's happened here is Alan had made a decision. The information was important, so he went ahead with his own time and his own skills, and without the benefit of any remuneration, was able to take and put the survey together, get it out to the 1,608 people and over 250 organizations. And what we're trying to do here is build this as a platform for you to be able to go to your employer and say, these are the national averages, here's where my salary is, here's what's going on in my general location, so that you can take and advocate for yourself in terms of the money that you're being paid. wanted to know what the salaries were. And then as we went along, we found more and more and more information as we went along with this. Alan, is that what you were looking for?
Yep, that was perfect. And I would add to that also, when you complete this webinar, there will be a survey for you to take that we designed some questions. It has two types of questions. I think there are 5 or 6. The traditional ones that are fairly simple for you to answer to show that you were paying attention so that iNAPS can award you a certificate. But we also ask a couple of questions relative to your compensation and how it compares to the information presented today, so that in answer to that person's question about advocating at the organizational or larger level for tier workforce, it will give iNAPS some useful information about its constituency to help figure out how it can best advocate for national standard, national compensation for this workforce.
All right. I think at this point what we should do, because I'm a little concerned about time, let's go, we want to thank Gotham for everything that they're doing and help making this possible by using this platform. Rita, here's where I'd like you to chime in. You're back on the phone?
Can you hear me?
I can hear you fine, Rita.
Okay, great. Because I got knocked off and had to dial back in. Okay, sure. As Alan mentioned, we do have a quiz that we need just for our records to be able to verify. When we give a certificate of attendance, we need to verify that people actually attended the webinar. And the way we do that is with just a 5-question quiz. And Alan did a really neat thing in this version of the quiz. He built in some research right into the quiz so that we're getting some good data from those who take the quiz. It helps us to determine where we go, as far as where we the things that we offer to our membership. So we really encourage you to go to the upper right corner of our homepage where there is this graphic of dollar signs and things. It's the same graphic that was there initially to enter the webinar. It's now been replaced with a link to information about how to access the quiz. This is now a member-only benefit of iNAPS. You need to join in order to get that certificate. So the information on how to join, and if you're already a member, then you'll get a link to the quiz, and you'll be able to get the certificate after that. Thank you.
All right. I do have one. We have time for one more question. I've got one here. What can you say about the future of peer specialists based on your survey results, Alan?
That's a great ending question. I appreciate it. So let me say a few things in conclusion. I think that we now know more about what peer specialists make. We know what they make in different parts of the country, which will allow different organizations and advocacy groups and individual peer specialists to begin to advocate on their own behalf for fair wages, fair compensation. There's some issues out there like closing the gender gap on wages that we talked about. But I would also call people's attention back to one of the very early slides Peter presented about community health workers. For those who don't know community health workers, they are kind of the peer specialist workforce on the medical side, but generally do not do their work based out of their own lived experience, but maybe on other dimensions of peerness that have to do with social and cultural status. And the medical side of the profession knows the community health worker field, the behavioral health field knows peer specialists. And so I think one of the challenging opportunities is how do we bring those together. And obviously in terms of compensation, which is the focus of today, they make on average almost $2 more per hour than peer specialists. And so we need to continually advocate for a fair wage. And as Peter said, I'm honored to be able to do this study and contributed to the peer workforce, the peer support services field, and I hope that you'll be able to use this report to carry it forward to promote your own role. And you've got our email addresses. I would love to hear from my innovative ways to use the report because that's how we hear and know what's going on in the field. So thank you very much for your attention, your time today, and we hope this information has been useful and productive.
Any of the questions that we did not get a chance to take an answer, please ask either Alan and I. If you send it to me, me and I can't answer it, I'll send it on to Alan. Again, if you send the question to Alan and he thinks that I answer it, he'll forward it to me. So these are ways that you'll be able to take and have that information. So I don't think that there's anything else. Alan, was that the last slide that was up before?
Yep, we're done.
Okay. All right. Listen, thank you all very, very much for your attendance. Thank you for, again, a wonderful, informative event. I hope this is helpful to you, and I hope you all have a great weekend. And we have more webinars coming up in the future. So stay tuned and look for our next webinar that we'll be doing.
Peter, could I add one last thing?
Absolutely, Rita.
I just want to thank David Barker for his recording these webinars, and the next webinar will be up within probably 3 weeks.
Good point. Thank you, Rita. And David, thank you for all your work of recording these so that they're available for people. All right, take care, everybody. Have a good week.